request D.K.Garg sir to felicitate Colonel Dr. V.S.Sarpal. Now I would like D.K.Garg sir to felicitate Dr. Thank you, sir. It is well said that time flies but no worries. I would like all the doctors to come here, please, light a flame of biscuit, sir. It is well said that health is real wealth and not a piece of gold or silver. A healthy person is an asset to himself, his family, his community, and on the other hand, an ailing person is a burden on all. Health is a pivot upon which a man's whole personality and his well-being depends. An ailing and aching body saps the enthusiasm for pursuit, functional activities, economic development, and spiritual upliftment. And the significance of health can be best described by the eminent personalities present over here. And with Ishan Family, we would like you, sir, to join us. Ishan, the Rising Sun, a Center for Excellence in Management Education established in 1994 by a great visionary, Dr. D.K.Garg, sir. Dr. D.K.Garg, he is one of the strongest pillar of Ishan Family and a person who needs no introduction. After that, I would like to take the opportunity to introduce Dr. Pankaj Bansal, Associate Professor, Medicine from Sharda Hospital. He is MD, MBBS, EMBA, FISE, FIACM, and FIMSA. He is a gold medalist in biochemistry as well as pathology and microbiology for 9 years, and his experience is guiding Kailash from a very long time. Thank you, sir. She will join us in a few moments. Thank you. Now, I would like to invite one of our senior students, namely Somesh, who would highlight the health problems.
My faculty members, my dear friends and juniors. Health is wealth. It's been said in yogic science, when your body and mind are in perfect harmony, you can be effective and efficient. So, to be effective and efficient, you need to have a healthy body and healthy mind. So, a healthy mind resides in a healthy body. as we know it. But if you look at the trend or the kind of lifestyle that we have been experiencing for the last 3 to 4 decades or so, it's quite hectic. It's quite, we can say, cutthroat competition is there. So my presentation, my PowerPoint presentation is all about how we handle our life. 4,000 hazardous chemicals. We have 250 very harmful chemicals, and out of that 50 harmful chemicals which leads to cancer. And cancer, tobacco is one of the main reasons in alcohol, consuming alcohol, especially in case of youth also. And getting intoxicated is also a very bad phenomenon in terms of you are causing harm for yourself and also your society, your periphery, your proximity, because you are disturbing the whole lifestyle of the person who are related to you. And the global information of alcohol and health is one of the World Health Organization initiative that's been taken.
Present here have cut short their time for their regular duties and are present over here. So it is very much important that today we are having the doctors with us. Please give a big applause for the doctors who have given us the time. Appreciate for the doctors. Okay, now
the jaundice, viral hepatitis, they are the most common. And what you can do is to have what you call purified water. There are various ways. You used to have earlier a candle filter, but a candle filter can remove bacteria and anyway, but it cannot remove viruses. Then next step was there was the introduction of this AquaGuard and all, where they have an infrared ray which can kill the viruses also. But then it cannot remove certain harmful chemicals. The third step came when you got RO filters where they can remove all the things. Okay, but then you require chemicals also, minerals also. So you're only having absolutely the water without any minerals is also not good. That is also harmful. Okay, so you have to have a balance of all this. Not only that you have a purified water, what is more important is who is handling it. Good handlers are more important. You have spent say 15,000-20,000 rupees, bought a RO filter and you have installed it, but the person who is giving you this thing water, he is dipping his hand in the glass. This is contaminating. All that money you have spent is waste. So whole chain has to be good. And they say a chain is as strong as the weakest link. So everyone, right from the water that you have purified, the person who is handling, all are important. So unless we have everybody in the chain doing all the things properly, the disease will continue to spread. So we have to ensure all this.
thank you, sir. So my next question is, sir, yes, I would like to ask Dr. Pankaj Bansal.
Good afternoon to everybody.
The major problem, and Dr. Sarpal have discussed, is diarrhea, hepatitis, jaundice we can have. Most of the students are turning up in the hospital are the diarrhea and the dysentery. Basically, if the blood is coming with the stool is the dysentery, and if the loose motion is there, then the diarrhea. Means you have to go for urgent intervention is required as soon as the blood is coming from the stool. And the problem of the water is the hepatitis A and B. The waterborne disease are the hepatitis A and E is there. Otherwise, typhoid may be there and gastroenteritis is there. The precaution, as Dr. Sarpal have told, it will be the same. Basically, wash your hands because we are residing in water, or we can make a hygiene. Wash your hands as soon as you go out. As soon as you enter the hostel, wash your hands. Every time you trim your nails, as soon as they are big, and don't put the ring fingers when you are going to the toilet or somewhere else, so that the infectivity may be less and you are prevented from the waterborne disease that are gastroenteritis, diarrhea, hepatitis. These are major common problems. As soon as the jaundice is there, then the student has to fear jaundice is there, पीलिया हो गया मुझे तो डॉक्टर भी क्या कहेगा 5 दिन जाओ 7 दिन रेस्ट करो 15 दिन तक. You have to suffer from the studies also. So basically you have to take care of yourself. After that comes with the water and other problems. And when you are taking the food from outside, you will make sure the food is from the proper shop. It doesn't mean that ready lagi hui hai, wahin pe golgappe kha liye, pani. So you have to take care that the water is from the RO system, that golgappa people are using the proper water or not, they are giving the proper water. Because when we are out, we take the water, ice creams from the local vendors. So you have to take the precaution. Till you are in the college life, you have to take from the precaution that we are taking the foods and all the articles from the proper shop, proper vendor, and he is washing the hand, hygiene is there or not. That's it.
Thank you, sir. So related to your question, question arises in my mind, like you that local vendor, they also supply us water. Whether it is hygiene in nature, can we purchase that and can we consume?
Most of the vendors, those who are giving the water, they are not purifying by the RO system. They are giving 20 rupees per 20 litre. How is it possible for them? Because they have to earn, they have to transportation, the cost may be up 2 rupees, 5 rupees per 20 litre. So still they will not possible. So it's better to boil the water if you are in hostel, or the hostel management will take care that they have to wash the where they are storing the water, that should be washed, tank should be washed over 15 days or the 1 month, so that the students can maintain the hygiene, because it is not possible for everyone to purchase the 70 litre rupees can Bisleri water. It's bad. Yeah.
Can we use a bacteria free? There is a drop actually that is we get it into the medicine's shop. Can we use that for preventing this type of water problem if we are not even having the provision for boiling water and etc.? Can we use that particular drop which actually makes our water free from bacteria?
You can, for everyone to drink the water. If you are taking the water from tap, then you are taking from that machine water. So everyone, the water is not suitable for everybody. It will take 15 days, 7 days, 10 days. Then the water may be suited to you. It's better the management will take care that the tank will wash.
I think management should provide the children with calling a RO filter so that children in the hostel they are getting.
We have to stay away from our home. There is a necessity apart from our hostel food. We just like to use to consume junk food even, because we want to get out of the taste, regular taste what we used to get in our hostel. So sir, what can be done in that case? Already you have given a measure, like we have to take it from brand shop and all these things. If our pocket is not allowing to do so, then what kind of any other measures can be taken by the students?
If pocket is not allowed, you will take within a golgappa, you have a golgappa, wait for another 7 days. It doesn't mean you are going every time and having a waste. Otherwise, you have to waste lot of money on the medicines, education. Your course is also wasted. You are supposed to go home. Parents will turn up. They are in burden. Because in Sharda also the number of parents are turning from the Kashmir, Shimla, UP. By taking the flight, they have to waste 5,000 for the flight for one parent, and they are in burden. They have to stop the job, or whether they are in business, they have to close the business, and they turn up for the papers for the kids. My kid is admitted in the hospital. I have to rush away. But it's better to take care, because when I am in the hostel, definitely I have also the same problem. Then I have to take care. Water is available in the tanks also. We are in the government colleges. So still the problem same comes. Whether I am in AIMS or in the Pune or in the Rajasthan, the problem is the same. But you have to take care of yourself. When you are taking the junk food, you will take care whether I should take once in a week, twice in a week, or you are taking from the vendor. So the vendor should be hygienic. Wash you should tell the vendor you should wash your hands, have a soap. That's it, and use the pure water, not from the tank or something else running water. He should use the pure water, so that the infection is less. If you are getting your body or where you are staying, that's the problem.
Thanks a lot, sir. Thanks a lot for guiding for this question. Next, I would like to move to Dr. Nakipuria. A very basic question, a biological question. See, ma'am, actually, when we basically among female, we have seen those who are generally of short height, those who are actually having to carry stilettos. And from this particular point, the females, they face a problem, that they face a problem of a spinal pain, they face a problem of a heel pain, Even I have seen that many of the females, they are facing a problem, like when they awake in the morning, they get a heel pain in the morning even, when they step down from their bed. After a period of time, it moves away, it removes away. So is there any measure of natural preventive measure which can be taken by this type of people who are generally of short height and who want to like everybody?
This question is most suitable for all patients, I think. This is not suitable for me, but models and others, they are using heels. So we can't avoid that. Go to home, remove your heels, take warm water, this bath, or take some safety precautions. Just warm
Okay, sir. I would like to, thank you ma'am, I would like to ask sir about this problem, like what can be generally done what can be the measures that can be taken actually, because we cannot avoid hills even. Exactly ma'am, actually we cannot avoid hills, but still we have to go with hill, and after a certain period of time we get a problem of this type.
models, 6 feet height, they are using heels. So short height is not a problem. It is not related to short height. This is related to moderation and this is personality. This is
Ma'am, but still to go with the fashion, what can we do please? If there is any medical, if there are any measures exist in the medical world, is there any measures to avoid this type of
nothing
thing?
particular. I don't think so.
Okay, thank you. So we can get, like those who are short height and those who...
Bone, calcaneal spur. There you can't do anything about it. What you can do is, if you have, you can put a more sponge at the heel side. You can ask your cobbler to put some more of sponge at the heel side, so that there is less pressure and you won't have pain. That is the practical way of doing it. Second is a plantar fasciitis, you call it, fasciitis. There we have to contact a orthopedic surgeon who will be injecting certain injections. He will give you some steroid injection which will remove the pain. So you have to go to the doctor. He will tell you whether to go for only putting a sponge or you need some injections to be put there.
So again, no one goes to cobbler these days. Cobblers are not available at all. So again, they have to go for high branded these heels. One heel will cost 4, 5, 6,000, and these are students. I don't think they can go afford that much.
Ma'am, streamlining your decision, actually what we get to know that either...
You might brush 2 times, 3 times, 4 times, but the end of the matter is how well have you brushed it. If you don't know how to brush it 3-4 times or 10 times a day, I'm sure you'll end up with brushing related diseases of the teeth. It's like, using too much makeup, you might end up with pimples. So you brush too much, you come with attrition of the teeth or abrasion of the teeth. So what I would like to tell you over here is, whether you brush using a brush, finger, toothpick, or good old days neem stick, that doesn't matter. What matters is, after brushing, make sure that nothing stays on your teeth. After brushing, you need to make sure that nothing stays on your teeth. The main cause of caries is nothing other than your food particle. The food that gets stuck onto the teeth, over a period of time, it undergoes metabolism, just like whatever we eat, the metabolism that undergoes in the stomach. Similar way, the food also undergoes metabolism, produces acids, and these acids are the one that demineralize the teeth. So it's not important what you brush with, whether you brush with a toothbrush, Colgate, Pepsodent, Close-Up, doesn't matter. What matters is, at the end of the brushing, you make sure that there's nothing sticking onto your teeth. Use your tongue, finger, whatever. Alright? Thank you.
Thank you, sir. From sir's discussion, actually, sir came across a word which is acidity. Sir, my general question to the general physicians now. Sir, what can be the natural remedy in case of acidity and gastric problems? What can be a natural remedy?
Because alcohol also increases the acid level in the stomach and your problem will aggravate. And thirdly, you should avoid spicy food. This means when you use too much of spice. Otherwise, if you are genetically programmed to have more acid, that will be there. Okay, so 10-15% of the population is having this problem. Okay, so if you avoid this thing, then if it is not something, you have to go to a doctor and ask for the medicine.
Level, or you can say that can affect our students in Delhi and the region of NCR, because they comes from various states, from various parts of our country, which may affect the weather of Delhi. It can affect our students. What are the general diseases that can be seen in Delhi and NCR?
Cough, body ache. So then you think of a viral fever. The viral fever, suppose the father name is viral fever, then the children name is the chikungunya, dengue, swine flu. Okay. If somebody says कि मुझे dengue negative आया तो मुझे viral platelets कम है, so then you say it is a viral fever. Viral fever is a major heading. HIV is also viral fever. Viral, it is a disease. Hepatitis is also virus. It is all the diseases are caused by virus. So you have to, it is a viral is a common heading. Viral fever we can say. Then if it, the major symptom is running nose, throat pain, body ache. And in this we have to take plenty of fluids, juices, fluids. And if the fever is going on, you have to take with the decongestant. If running nose is there, body ache, you cannot take go with the aspirin. Instead of going with the aspirin, you go with the paracetamol. You can take 60 times of your body weight. If your weight is 60 kg, so you can take 3600. Whatever the body weight is yours, you can take the 60 times of the paracetamol, and it is safe in the body. Okay, if the 60 kg, so 3.6 gram you can take the paracetamol. It means you can take, tablet is 500 milligram, you can take 5 tablets, 6 tablets continuously, so that fever is calmed down. Because
so don't be so so paranoid about fevers. You have to bring it down to 98. No, not required. That's what I mean. Everybody is so much paranoid. बुखार नहीं गया, बुखार नहीं गया, बुखार चला जाएगा. क्यों बुखार है? That is more important. If it is malaria, you should treat malaria. Automatically fever will go. If it is typhoid, you will treat typhoid. Automatically fever will go. Over here I find people so much concerned about this.
Thank you,
this
sir.
is one point I want to add. If the fever is high, you go with the cold sponging. Cold sponging, that should not be done on the chest. छाती पे नहीं करना है और कान में पानी नहीं जाना चाहिए. Otherwise heart will stop immediately. अगर जो पानी की पट्टियाँ करते हैं वो छाती पे नहीं करनी है और कान में पानी नहीं जाना. Otherwise heart उसी वक्त रुक जाएगा. That will lead to the bradycardia. So you are supposed to go the sponging all over the body. This way.
Even we have used this type of paste, toothpaste, but still we do have sensation, tooth sensation. Do really this type of brands, it helps out to stop this sensation?
Very good afternoon. Actually see, whatever pastes are available in the market for the sensitive toothpaste, they work up till a certain level only. Basically the tooth has got three primary structures. One is the enamel, that is the outermost covering of the tooth, then the dentine, and the inner part is the pulp. If the caries has gone up to the primary dentine, see dentine has got two parts, primary and secondary. If the caries is superficial and it is up till the primary dentine only, then sometimes the sensitive toothpaste available in the market will work. But if it has invaded deep into the dentine, then nothing is going to work except the dental treatment.
Answer, they will give it to us. Thank you, sir.
Now I would like Aman ma'am to felicitate Dr. Ruchi Srivastava. Give a big round of applause for Dr. Ruchi Srivastava. Dr. Ruchi Srivastava is senior consultant and gynecologist, ma'am, and she has been a gold medalist in university and in MD. Doctor. She has also won Dr. D.K.Garg Memorial Gold Medal to the best student in final professional MBBS, and she has been into many national and international research papers. Thank you.
We want to go for an open discussion with the students. I would like to call Abhishek Srivastava to take on the mic. We will be attending the students over there. Problem, even if it is prevailing with your mother or your auntie, whosoever, even the boys can go for basic gynecological questions.
Urocaphobes aquaguard, okay.
I have seen in the market that there is available Geolit or Geoline kind of a product. Is it safe enough to use?
Disease or dysentery and all, but not viral disease. Jaundice and all, that cannot be, because those filter cannot this thing check virus. So virus will go through.
Thank you, sir.
Myself Vikash. So my question is that we have seen that our parents used to give us medicine whenever we are having fever or anything. So you don't think that we are destroying, means our parents are destroying our immune system? The thing is that when we are having fever, why not we are taking precaution and waiting that it might be get right. After that we take medicine or...
When I am kid, my father is giving a medicine of the fever or something else. So it means they are putting a resistance to our body. Suppose antibiotic 5 दिन देना तो उन्होंने कहा 2 दिन ले लो चलो ठीक हो गए. So that is putting a resistance. One is resistance to your body and to ourselves, to the community also. One is the single resistance, second is the multi-drug resistance. Multi-drug means one resistance to yourself and two other you are residing with the community, they are also resistant to the drug. अगर जो 5 दिन दवाई लेनी है एंटीबायोटिक और आपने 2 दिन खा ली तो definitely they are creating the resistance to the drug. This time if the drug is working ciprofloxacin, at this moment the drug is not working. So we have to go with the higher antibiotics, levofloxacin, moxiflor, any other drug we are going for higher antibiotics. As you go with another Fortis, Apollo, Escorts, they are using the higher antibiotics. What we are using in the last stage, because these drugs we are not using, because that drugs are not resistant in our hospital, but they are resistant. They are using the last option, they are using on the first option. So that's why that you should take care कि parents are giving, when you become a father, you should take care, you go to the specialized doctor. Instead of putting a crocin to your baby, have it crocin and okay, it's okay. Or you go with some another doctor, go with a specialized pediatrician or the physician. When you have any problem to your parents or somebody else, you go have a full course of antibiotic. Instead of going with a 1-day antibiotic, 2-day antibiotic, because the cost is definitely high. The cost may be a 400 rupees, 500 rupees, and we are reluctant to pay the doctor fees because we think why doctor is charging. Instead, he will give the medicines, I will pay for the huge amount of the medicine instead of paying for the doctor fee. So we should avoid these issues in our mind and we pay to the doctor, or instead the doctor is not taking the charges, you will take the full antibiotic.
Whenever I travel by bus or car, I feel like nausea and vomiting. Could you please suggest me some measures and reason why it is happening with me?
See, the information that is going from the eyes and from the ears, you have got a balancing organ at the back of it, okay, cochlea. So when there is a mismatch between the eyes and this, then you get vomiting, okay. And you can take simple avomine tablet or a perinom tablet, it will not have.
Thank you, sir. So I have a question here. So basically, as per the doctor advice, everyone should take a sleep of at least 8 hours. But as a student life, we are not able to take a 8 hours sleep because we are just generally take a 6 or 8 hours. So what are the alternate option? Because in a class we commonly feel sleepy or lazy. So what's the option for that?
How many hours in the day you study?
So I study hardly 2 or 3 hours.
Now let me tell you, even in my MD I have slept 6 hours a day.
Okay.
Okay. And I think we read much many, lot of number of books than you people read.
Exactly, sir.
So other MBBS or MD, I have had my full sleep even during examination time. So,
sir, but apart the studies, we students
if you have been studying regularly, you will be able to sleep. If you just want to study on the 1 week before, then this problem will be there.
Yeah, exactly. Sir. Thank you. We are going through these things only. Thank you very much, sir. Anyone else having a question?
Thank you, sir.
But sir, in India, 30% people are below the poverty line and they have not purchasing power to buy a water filter. What kind of precaution they take, sir? What kind of remedies they take? What we have all free. They are asking if we have a gastroenteritis, loose motion, any problem of hepatitis. They should take care of their hygiene. Wash the hands as soon as they go outside the home or use the daily work. Whenever they need जब आटा गूंदेंगे, then they will have to wash the hands. Whenever they feed the baby or anything, they have to wash the hands. Every time they take care of their hygiene, of the kids as well as of the family. Then we can definitely reduce the incidence of the waterborne diseases.
Boiling the water is the best option for that, sir, I guess. Thank you.
Okay, students, before we proceed, we would like to request you people to cooperate with our medical practitioners because they are giving certain valuable answer. Rather concentrating on your question, you should also go with the diagnosis they are actually giving to you people. So please concentrate on the valuable answer they are giving to your doubts or queries you people are having.
Good afternoon, sir.
Most of his friends they do have the problems with alcohol, might be he also not taking them.
Not alcohol.
What are the preventive measures?
Side. I read it somewhere that men who are bald are more sexier. So that's the brightest side you can actually. Next question.
Now our faculty, one of our faculty member Pooja ma'am, do have a question. Please, if you
doesn't consume green vegetables, milk and milk products, and they believe in taking supplements instead of having food. Supplements like vitamin B, iron capsules. So sir, are these pills or medicines are the perfect substitute of that food or?
I don't think so, because most of the time the concept of fortification means your food is going with the B12 and all the vitamins, vitamin D. In the USA, the concept is already there. Whenever you take the food, it is already fortification. And you see, if you are buying atta, then there is also a fortification is come. There is a vitamins and minerals are adding up. Instead of taking the pills, you will take rich fruits and vegetables and milk. And milk should be a good quality. It doesn't mean you take from outside and that should be 3/4 water and 1/4 milk. And you continue with all the curd, you can take curd, fruits, and avoid the pills. Avoid the pills and you go ahead with the fruits. That will compromise the vitamin deficiency. It will complete the deficiencies of your body.
Thank you very much, sir.
So my name is.
Okay, sir. We will proceed with you also.
So my name is Gautam. I'm a faculty here. My friend is having. I want to ask to the dentist. My friend is having a yellow teeth. His teeth is yellow. He tried n number of toothpaste, but still the stains, the yellow stain does not go away. He's a non-smoker. He's a non-alcohol. So then there's a yellow teeth or yellow stains in his teeth. So is there anything on it?
Fair people have yellowish teeth and the black people have whiter teeth.
Thank you, sir.
Just to take it forward from what sir said, see, for having yellow teeth is not a crime or sin. It's all about your confidence. For example, it's like you're asking us Rajnikant, why is he not sad for not being as fair as Ranbir Kapoor? But Rajnikant is still a superstar. So what I'd like to tell you is, yes, if that yellow stain is something that's intrinsic. See, now stains could be one, external because of consumption of tobacco, alcohol, coffee, tea, food substance, etc. Such cases your toothpaste will help, my cleaning will help you in such cases. But sometimes you may have yellow teeth based on like what said, the color of the skin. Skin and teeth are derived from the same cells, as a result of which the color of the teeth matches with the complexion. But some cases it could be because of something called fluorosis, because of consuming water with fluoride content that's more than permissible limit. So in such cases they may end up with a yellow teeth. Or sometimes because of certain disturbances during during pregnancy. So in such cases, if you really want to work on the yellow teeth, a simple cleaning or toothpaste won't help. You'll have to undergo something called as aesthetic treatment, wherein we give you caps, bleaching, or composite veneers, something like that. It's like, you're going for your facial. So we can only help you with that, and let me remind you, it's very, very expensive.
Thank you, sir.
Thank you, sir.
Yeah, we're having a next question now.
Age of 15, 20, maybe insulin deficiency. And second type is maybe acquired. It may be at the age of 35, 40, 30. Because in our OPDs we will see most of the patients are turning up of 25, 30. One patient is lying in our hospital, that age is 20, is type 1. Because it is a congenital, initially from the birth only. Maybe it is diagnosed at the age of 10, 12, 15 years. In the type 2, normally it is the basic concept of to avoid the diabetes. You have to take care of your weight. obesity that will play a major role in the diabetes. So that should you have to take care. You just avoid the junk foods. You have to take the exercise regularly up to 30 minutes. You have to avoid the fat foods. As soon as the obesity will goes on, the one syndrome is there, metabolic syndrome, or we can say the insulin resistance syndrome. In this, insulin will not work, and then insulin will not work. That means the glucose metabolism is not there, and you are prone to the diabetic patient. Metabolic syndrome may occur at any stage. Maybe a fasting sugar is high, blood pressure is high, cholesterol levels are high because of the obesity that lead to the metabolic syndrome. And in this stage, the patient may convert, or any person may convert into the diabetes within 5 years. So you should take care of the junk foods, oily fat foods, and just to take care, you should take the exercise of the 30 minutes. It doesn't mean that you have to go get up early in the morning and go for a walk for 30 minutes. Instead, you go for a Ishan to the Jagat farm for 10 minutes and come back. It means your walk is 30 minutes. Okay, that's it. If you are genetically prone, then maybe you have to take care more precautionally, and you have to go with the investigations after age of 30, routine investigations about the blood and all that, so that we can come to know. And another test is we can go with the last 3 months sugar also, glycosylated hemoglobin. We can come to know the blood sugar of last 3 months, so that we can come to know whether I should take care of the sugar or something else. And if you are taking laddus of 5, so then you should avoid any junk food on that day or on that week, so that we can prevent from the diabetes.
Hello sir, my name is Prima. Sir, my question is that does asthma go in future generation?
It doesn't mean it go into the future generation. That is intrinsic asthma and extrinsic asthma. Extrinsic asthma means you are getting pollution from the outside. Whether the asthma may be from the different region, maybe a pollen, another region may be a smoke, whether it is a pollution. So you have to take care of all the things. If the pollution is going on, and suppose petrol vehicles are there and pollution is so much, we are residing in Greater Noida, pollution is not so much. As soon as you preside to the Delhi or NCR, then you see the number of polluting, number of persons are converted into allergic bronchitis. And if it persists for more than a few years, then it definitely will convert into the asthma.
Sir, my question is that see, if I'm in normal position or normal condition, my life goes very easy. But wherever I am in tension, this asthma attacks increases.
Yes, stress-induced asthma is there. That is a stress-induced asthma. It doesn't mean you will convert into the asthma. As soon as the stress level is decreased, the leukotrienes receptors, those are receptors responsible for the stress-induced asthma, means there is a bronchospasm. Asthma means there is a जो हमारा whatever the lumen is, ये सांस की नली है, और इसको अगर ये कम हो जाएगी, that will lead to the asthma. It is a bronchospasm of the lumen of the airway. That is asthma. Whether maybe any other reason, exercise के कारण हो सकता है, आपको कोल्ड ड्रिंक के कारण हो सकता है, एक्सरसाइज स्ट्रेस के कारण हो सकता है, pollution के कारण हो सकता है, pollen grains के कारण हो सकता है, maybe any other reason. So you should to take care, and it doesn't mean you will convert into the full-blown asthma.
Thank you, sir.
Last, we can take 1 or 2 questions at the most, and we have to wrap out because our doctor needs to leave. So 1 or 2 questions can be attended. If anyone has to have certain question, please ask fast, and we want to release our doctors first.
Hello sir, my name is Subhash Yadav. Sir, one of my friends have a problem is that from his tooth, there is a tooth decay and smelling from his mouth. And sir, other problem is that his gums, there is always blood. So what is the preventive measure, sir? And after measure also?
All right. See, we don't have one single cause as to why there is bad breath. There are a lot of causes, right from simple poor oral hygiene, if you don't brush properly, or if you consume very less water during the day, or if you're eating smell-producing food like garlic, onion, etc. So there's no one single cause. Even diabetes patients come with a sweet breath, which is bad. So we'll have to actually evaluate what's the cause of that breath. But most common cause would be too much of smoking, too much of tobacco consumption, not brushing your teeth regularly. These are the most common causes. Or not rinsing your mouth after a simple meal. That's the most common cause of bad breath. So if you can take care of all these things, and if still the bad breath persists, then you'll have to come to us so that we can evaluate you. Alright? And another, you said the gums bleed frequently. That's probably because of the gum inflammation, which again is related to poor brushing measures. So, and these things can't be handled by yourself. If the gums are bleeding, you'll have to visit us, and only then we'll be able to help you in such cases. Thank you.
Any other questions? Please. The last question after Durgesh we will take from BX session. So can we we can proceed further. Take it?
Sir, my question is, when I play at regular basis, I got pain in my backbone. And what should I do? Because I am crazy about sports. And I got a very happy when I play at regular basis. So please suggest me something that so I can continue with my studies as well as my sports.
When you are taking a regular any game, then may be a pain because of the overuse of the muscles. You just take the food of high protein diet so that the muscles may be relaxed. Second, different causes can be ruled out. If you are continuously pain, you can have a blood sugar, you can check out. One is the hypermobility syndrome is there. One patient last, I think 20 days back, she is a national player, she has turned up with a body pain because then somebody has told that there is a hole in the spine. But at that time we diagnosed a hypermobility syndrome. So then you go with the physician or the orthopedician and check out what is the reason behind the pain of the muscles. If you have regularly pain, if you are taking the food with the rich proteins and all the vitamins, then I think we can come to know, and another physician will come to know what is the reason of getting the pain regularly.
Thank you. Last question from BH session. Before going with the BS session, I would like to give the mic to Lucky ma'am because she do have a...
I just want to ask a question to Ruchi ma'am, and that generally that all the females or all the girls have a problem of anemic. Like their hemoglobin is not as good as we compares to male. The reason is how can they increase their hemoglobin level?
Thank you ma'am.
If it is only related to gynae problem, then because anemia is a wide topic and it can be in males also, but as you said, it's mostly seen in over here in females, because as we all know, every month females do have their menstrual cycle, and the loss is always there every month, and it depends upon the loss, how much loss she is having. The average loss every month, if she is having every day, we see it's like 40 ml, minimum like 30 ml to 40 ml. If it is increased more than 80 ml per day or more than that, then anemia develops in the females. Secondly, it's the eating habit, what food they are having, if they are the hostlers, or even if they are not the hostlers, because these days we mostly see they are more, the favorite has become the junk food. So junk food is just a junk kind of a thing. So it does not contain, it has to be a balanced diet for everybody. Balanced diet means containing everything, like including minerals, vitamins, proteins, carbohydrates, even fats also in some amount. For the fat soluble vitamins, we need fat also. It has to be a balanced diet. Thirdly, they have to just get the checkup done for if there is there any infection, they are interested to any infection which is leading to this anemia. So these are the basic things.
The general problem nowadays thyroid. I think it is also becoming a biggest problem for all of the females. Even if you can see, like most of the females, I have a thyroid problem. So even I want to ask what is the general, or if I take medicine daily, it would prevent someday, or I have to take medicine all of my life.
The thyroid problem is because we are becoming more aware of this. Earlier, these tests were not done on routine basis. Now the patients are coming and these tests are done, and this is being picked up. So my physicians over here are the best people to tell you about it. Yes, I do get patients in pregnancy also, and as a routine, I get the thyroid stimulating hormone test done for them, and I'm picking up this problem in the pregnant patients also. And then we need to start the medication for that as we are treating the patient if they have hypertension or diabetes, and they are getting the medicine on regular basis. It's the same for the thyroid patients. We have to treat them on the regular basis, and regularly we have to get the test done like 3 months or accordingly.
Even I can ask this question to sir also, that I have to take medicine all of my life, or
If you are hypothyroid, you have to take your medicine all your life. Most of the time.
Most of the time you have to take the thyroid tablets, but if you want so willingly to, whether you want to you have to take the continuously, then you go with the anti-thyroid antibodies. If they are positive, then you have to take lifelong, that is confirmed. If it is negative, then you think for 2 to 3 years and then stop the medicine and check it out. But if depending upon your value of TSH, whether you are fully thyroid or incomplete, that is subclinical hypothyroid or hypothyroid.
If we can have these questions in the second session, please. Okay.
I have suffering from digestion.
Okay, he is having digestive problems, sir.
We have already discussed, as well as where you are residing, you have to take care of the food. Where you are purchasing, you have in your lunch, dinner from any vendor, those vendors who are bringing your food, lunch or dinner. जो आपके लिए खाना लेके आ रहा है उसको देखो कि वो सफाई से खाना आ रहा है कि नहीं आ रहा है. अगर आप ही को प्रॉब्लम है तो फिर आपको देखना पड़ेगा कि भाई जहाँ से आप पानी पी रहे हैं या कुछ, या बाकी स्टूडेंट्स भी जो आप खाना जहाँ से खा रहे हैं सभी को प्रॉब्लम है, तो खाने में प्रॉब्लम है कोई. अगर सिर्फ आप ही को प्रॉब्लम आ रही है तो देन वी हैव टू टेक, तब हमको ध्यान रखना पड़ेगा कि पानी की कोई प्रॉब्लम तो नहीं है, या नेल्स पड़े हुए हैं कहीं, गंदगी और कहीं तो नहीं है. अगर फिर भी नहीं है तो लास्ट ऑप्शन इज द मोटिलिटी डिसऑर्डर. एक मोटिलिटी डिसऑर्डर होता है जिसके अंदर आंतड़ियों के और हार्मोन का गड़बड़ाने के कारण ये ऐसी प्रॉब्लम आती है. तो जस्ट डॉक्टर के पास जाओ, फिजिशियंस के पास, और उनसे मिलो, देन आपको बताएंगे कि ये मोटिलिटी डिसऑर्डर है, गैस्ट्रोएंटेराइटिस है, लूज मोशन के कारण इन्फेक्शन है, या पानी की प्रॉब्लम है, या आपका हाइजीन की प्रॉब्लम है.
Okay, thank you, sir.
I have a question related to muscle building. How to build my muscles?
Only way is to do exercise. That's the only way to do it. Go to a gym, start pushing up weights, and that's the only way to do it.
The precaution is
there's no pill to increase your muscles.
The precaution while doing the exercise, don't take the protein powder from the gyms, because that will damage your liver and kidney. Once you feel your body is built, but after a few months or few years, you come to know your kidney is already damaged, you are on the dialysis, liver is failure, and you are going to die. So don't take the protein powder from the gym people, because they are promoting their, this is a protein powder, आपकी muscles बन जाएंगी, आपको बहुत अच्छा लगेगा, and then you feel wow, muscle is there. Still after few years you will come to know that liver and kidney is already damaged. Okay.
Thank you, sir. It's not a joke that 1 rupee pan parak could end up with a serious condition called as cancer in your mouth, or that 2 or 3 rupees cigarette or BD can end up with cancer for lifetime for you. So my request to you all youngsters is to stay away from tobacco products, and please don't make it a lifestyle fashion. It's a very serious habit. My request to you all is not to use tobacco. Thank you.
Dr. Guru Ian. Sorry. Now, I'd like D.K.Garg sir to present token of love to Dr. V.S.Sarpal.
Before proceeding further, all the students will leave except girls. We will have a gynecological session in the conference room with our eminent gynecologist.
So please present a token of love to Dr. Ruchi Srivastava